Audiology, it's a profession of evaluating and treating hearing loss, balance disorders, tinnitus and ringing of the ear. We work with anywhere from the newborns all the way to the geriatric age. Our training is a doctoral level, so we do have 4 years of an undergraduate degree, usually in like speech and hearing science, and then we have a 4-year doctorate degree in audiology. Our practice, again, we see both newborns as well as older adults, and we do anywhere from if a baby does not pass a hearing screening in the hospital, they will come here and we'll actually screen the baby's hearing here at our clinic to see if they allow them to pass that or not. We actually will fit hearing aids to children here as well, should they have a hearing loss. We do medical testing for our physicians. We have a large network of physicians that refer to our practice, looking for reasons why people may have hearing loss or may have issues with ringing and balance issues, and then we refer them on to the proper place, whether it's back to the physician or to an ENT, ear, nose, and throat doctor. We also do a lot of hearing aid fittings with adults as well, and working with assistive listening devices with our adults patients, where if they need something for a television to help them hear TV better. And also our tinnitus patients. We have patients with ringing or buzzing in the ear, and oftentimes that can be detrimental to their lifestyle, and so we help them learn how to train the brain not to hear that type of a sound and kind of get used to it. But a lot of our practice is really based on hearing aid dispensing and really improving people's quality of life through better hearing through hearing aids. Our first responsibility for our patients is a medical exam, and so when people come to see us, usually something has happened to trigger why they've come in. It could be a sudden hearing loss. People are just beginning to notice that they have difficulty hearing, understanding speech. Oftentimes, unfortunately, it takes somebody 7 years to come and see us. 7 years prior, they have found out they feel that they have a hearing issue, but it takes them 7 years to finally come into our doors. So we're trying to improve that if we can. But when somebody does walk into our office, we do a thorough case history. It's a medical case history. We look into their ear canals to make sure it's not an earwax issue, make sure the eardrums are functioning and there's no holes in them and such. And then we bring them into our soundproof booth, and we have a thorough exam where we actually are looking at giving them beeps in their ears and allowing them, or helping us see where they hear and how they hear in certain pitch levels. We also test them with speech in quiet, as far as a quiet room, and we also then teach them adjust the speech in background noise situations. Everybody does differently with hearing and background noise. We want to see how well they understand speech and noise. Then after that thorough exam, we will then bring the patient out and have a discussion about where they are with their hearing needs, what is their quality of life like, how active are they. Is it something that we have to refer the patient to a physician for to have that correction? Not all hearing losses need hearing aids. Sometimes the physicians can do surgery or a correction in order to help that. If it is a hearing aid or other kind of assisted listening device, then we will walk hand in hand with them as well in that process to make sure that that's a positive experience. So it is a lot of detail. It's a lot of spending a lot of time with the patient and their family, by the way. It's really wonderful to have the family here as well, because hearing loss, you can say the word hearing loss, it's actually a communication loss or a connective loss. When you have hearing loss, you lose the ability to relate to your family, to your friends. And so when you lose that connectivity, our natural instinct is to start withdrawing. And so we start staying home more often, or we will stop talking, because it doesn't take too often for somebody to, if they've been asked a question and that hearing impaired person will then give them an answer and it's the wrong answer. As a human being, we get embarrassed a couple times. We'll stop asking or answering the questions. And so that's what hearing loss does. It takes away our lifestyle and our life. And so we're trying to improve that for people, obviously, and get them back involved.